Hi, this is Dr. Reynaldo ROJoson, Director of ROJoson PEP Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Goiter, Myth, and Tips. This is part of the health issue courses. The empowerment objective is for the lay people to have an understanding of the issues involved in goiter. Operational definitions of terms in the title. Issues. These are the mindsets and practices of people, both lay and health professionals in the community regarding a certain topic that are open to question as to their validity, and they may be considered myth or widely held but false beliefs and ideas. Tips means advice. Advice from Dr. Reynaldo ROJoson. These issues, mindsets, and practices have created a lot of confusions among lay people and health professionals in terms of health care and medical management, which has resulted to unwanted anxiety among lay people and unnecessary and erroneous medical management by health professionals. Thus, because of this, there's a need for tips or advice. There are a lot of issues involved in goiter from the perspective of the lay people as well as from the health professionals. I will just tackle some, at least 5 issues, and give tips or advice. These are the issues that I will be discussing. Concept of goiter, bawal this, that, foods in relation to goiter, sa loob o sa labas na goiter, interpretation of TSH or thyroid stimulating hormones, low dose of suppressive therapy for colloid goiter. Let's start with the concept of goiter. A lot of people and healthcare professionals have the concept that goiter is a benign condition. This mindset has a reason from the encounter in the olden days when iodine deficiency or endemic goiter was prevalent. Nowadays, even in the Philippines, iodine deficiency goiter is not common anymore. However, this mindset is still a carryover of old mindset or of olden days. So the tips, a goiter is used nowadays to include any and all disorders of the thyroid gland, both benign and malignant conditions. The most common presenting sign, initial or first cue of goiter, is the visible increase in the size of the thyroid gland. A lot of people and healthcare professionals just call the visible increase in size as enlargement without qualifying whether the enlargement is diffuse or nodular. So this illustration shows a diffuse enlargement of both lobes of the thyroid gland. There are 2 major lobes of the thyroid gland, the right and the left. If there is diffuse or almost symmetrical enlargement of the 2 lobes, we call that diffuse goiter. Nodular means either one of the lobe, right or left, is 2 times, 3 times bigger than the other side, or there are palpable nodules on either one or both lobes. So in these situations, nodular goiters are present. This mindset not qualifying whether the enlargement is diffuse or nodular has not facilitated the formulation of a clinical diagnosis, and it has led to non-specific diagnosis and shotgun approach in ordering diagnostic procedures. The diffuse enlargement or diffuse goiter has diagnostic implications that are different from nodular enlargement or nodular goiter. So example, diffuse goiter has the implication whether the condition is hyperthyroidism or hypothyroidism, both of which are classified under functional disorders. Nodular goiter, on the other hand, has the implication of a tumor that can either be benign or malignant, cancer or not cancer. So this involves the structural disorders. So the tip is determine whether the goiter is diffuse or nodular, as it will facilitate formulation of more specific diagnosis and avoid shotgun approach in the diagnostic procedures. Second issue is bowel this and that foods in relation to goiter. Oftentimes, lay people ask whether eating cabbage, cauliflower, cassava, and other foods are prohibited or bowel as they can cause or aggravate an existing goiter. Oftentimes, health professionals answer the lay people yes, because of the readings. Some of the foods of concern on goiter are the following: cabbage, cauliflower, broccoli, cassava, soy, and kelps. There are others. So, bawal ang cabbage, cauliflower, cassava, etc. for thyroid because they can cause or aggravate an existing goiter is a myth. So tips, they are not bawal, they are not prohibited. The bottom line is everything, every food is fine as long as it's eaten in moderation, and the food will not cause goiter for the most part. Excess can cause hypothyroidism or hyperthyroidism. Again, as a general advice, diet will not make your thyroid disorder go away and will not cause thyroid disorders. The third issue is sa loob o sa labas na goiter. Oftentimes, people use these terms, sa loob, sa labas, ang goiter. I don't really know the origins of these terms as well as the exact meanings and significance. But I surmise, sa loob, lay people will be referring to hyperthyroidism when they feel symptoms and the thyroid is not yet very big. Sa labas, lay people may be referring to the bulging masses visibly seen on the neck without symptoms. So tips, don't use these terms if there are no good basis and they have no effect in the medical management. In the medical world, we don't use these terms as goiters grow in size within the neck first, sa loob, that's natural, and most of the time, then outwards, palabas, again, it's natural, a natural happening, whether the patient is toxic or non-toxic goiter. Another issue is the interpretation of the TSH or thyroid stimulating hormones. This is a frequent test being done nowadays. Oftentimes, physicians place greatest reliance on the TSH to assess hyperthyroidism and hypothyroidism. The other tests being done are T4 and T3, which are thyroid hormones. Some experts would say TSH is the best and oftentimes the only test needed to assess hyperthyroidism and hypothyroidism. My experience, however, is that there is a lot of errors in the TSH determination. The tips, Always correlate the TSH results with the clinical picture of the patient before acceptance. Correlate means check if the clinical picture is compatible with the TSH results. Do not just accept TSH results hook, line, and sinker. That means without reservation. Case in point, 25-year-old female diagnosed to have hyperthyroidism in 2019. There were good bases for the diagnosis of hyperthyroidism because of the presence of a diffusely enlarged thyroid with no nodules seen on ultrasound. The pulse rate was fast, more than 100 per minute. And then there were fine tremors on the hands. And the FT4 was elevated, was high. TSH was low, which is the usual interpretation for hyperthyroidism. So the TSH value jive with the clinical picture of the patient as she has diffuse goiter, fast pulse rate, and then tremors. Okay, so we accept the TSH values as valid. Okay. Patient was given PTU tablets taken religiously, but the TSH has not changed in low value despite 1 year of PTU up to September 2020. So I decided to change the meds to methimazole, another kind of anti-thyroid drugs, taken religiously for 6 months, but still without improvement in the TSH value. I was wondering already what was happening. No improvement in the TSH for 1 year and a half despite the change in medications already. So I requested an RIA, radioimmunoassay method of testing instead of the original ELISA method. Lo and behold, the value came out to be normal. So in retrospect, there was error in the initial TSH value or ELISA. So that shows the importance of trying to correlate the clinical picture. Another patient, 30-year-old female diagnosed to have hyperthyroidism by a physician on the basis of one TSH determination and value, which was below normal value. For this, a hyperthyroidism was suspected. The other thyroid function tests were normal, like T4 and T3, and there were no symptoms and signs of hyperthyroidism. So the patient was prescribed and was taking anti-thyroid drugs for 1 year before consulting me. I doubt the diagnosis of hyperthyroidism because there were no symptoms of hyperthyroidism. So I asked the patient to stop the medications and monitor himself or herself. Then repeat the TSH after 6 months of no medications. And the repeat TSH showed normal TSH and T4 values. Again, in retrospect, there was error in the thyroid stimulating hormone values. So with such an error, one can condemn or consign a patient to have a thyroid disease. Okay. Specifically, hyperthyroidism in this particular case, if error is not corrected. The last issue is low dose of suppressive therapy for colloid goiter. Oftentimes, physicians advise patients to undergo surgery for benign colloid adenomatous goiters, even if they are still small and or after no response to treatment with medications. So with no response to medication, they're advised to have an operation. Oftentimes, the dosage given is inadequate and monitoring duration of response is not enough. These are the common pitfalls by physicians and possible explanations for this because of the mindset that it is always dangerous to give high dosage of levothyroxine. So they just give the low dose. And then the other mindset is that colloid adenomatous goiters usually do not respond to medical treatment. With this approach, I have saved a lot of patients with colloid adenomatous goiter from unnecessary operations. I usually give a high dose of suppressive therapy in the form of levothyroxine for colloid adenomatous goiter for about 6 months or longer. If there is response, I gradually decrease the dosage. So takeaway and summary, I have discussed the issues involved in goiter, concept of goiter, bawal this and that foods in relation to goiter, sa loob o sa labas na goiter, interpretation of TSH, low-dose suppressive therapy for colloid goiter. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on issues on goiter. Knowledge is power. It gives power. Use the 4 keys of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in managing goiter. With that, I end my pep talk. Goiter, myth, and tips. I hope I have empowered you, the lay people, to have a better understanding of the issues involved in goiter. Thank you and good day. Mabuhay kayong lahat.